Hi everyone, thanks for joining this webinar, and we're just letting everybody join, so we'll just give it a couple of minutes for people to join in.
Hello Mary, thanks, I will be on mute.
Thank you. And just asking if everybody could just go on mute and not share your video as well, just so that we reduce interference and maximize bandwidth for everybody on the webinar. Thank you. Okay, we'll just give it a minute more. As you're all joining, I'm just encourage you to maybe put in the chat box who you are and where you're coming from, because it's always nice to see who we have on the call and to share with each other. So just as we take a moment for everybody to join, you can just pop your names and who you are in the chat box. Okay, so we're approaching 4 minutes past the hour, so I think we'll get started. Thank you so much for everyone for joining us on this webinar today, where we're going to share some reflections from ENN on things that we hope will contribute to how the UN Global Action Plan on Child Wasting can help secure continuity of care for wasted children. It's going to try this. So just a bit of housekeeping to start. So my name is Marie McGrath. I'm one of the technical directors at ENN and Field Exchange co-editor. And I'm joined by my colleague, Jeremy Shoham, also technical director and Field Exchange co-editor. Natalie Sessions is senior nutritionist at ENN, and Lara, who is our administrator, who's going to support us keeping this show on the road for the next hour and a half or so. Please keep your video off and mute your microphones, please. As I said, this will help minimize interference and maximize the bandwidth for all of you participants. We are recording this webinar and we'll make it available online within the next 24 hours. In terms of our format for today's session, I'm going to kick off with a presentation of about 30 minutes or so, with a few moments for any direct clarifications on what I present. We'll then immediately move on to a panel discussion where we have representation from UNICEF, WHO, WFP, FAO, and indeed UNHCR will also be joining us to handle any questions regarding refugee contexts. We've got some questions that we have shared with the UN representatives in advance of this webinar, and they'll be addressing those, and we will share those questions on our screen as we go through them, just for easy reference for you all. There will be some opportunities to answer some questions from plenary, but we won't take direct questions, but please put your questions in the chat box and we will select a couple from those, and time permitting, we'll address them to the relevant UN agency in their session. Any outstanding questions that you post on chat box, we will share with the UN delegates post-webinar. And as I say, maybe just pop in a little introduction to yourselves in the chat box just as we're starting off now. But before I go on, I would like to introduce the panelists just by name, and then we will see them when we start the discussion a little later in the session. So we have Victor Awego, who's the Associate Director and Global Chief of Nutrition for the Programme Division at UNICEF. We have Saul Guerrero, which I'm probably making a mess of his surname, nutritionist specialist for care for children with severe acute malnutrition, again the Programming Division at UNICEF. We have Francesco Branco, who's Director of the Department for Health and Development at WHO. And we have Zita Weiss-Brinzo, who is Technical Officer and Focal Point for Undernutrition and Emergencies, again at WHO. Then two of the team from WFP join us, Alison Oman-Lawi, who's the Deputy Director of WFP Nutrition, and Nicolas Johannes, who's the Chief of Operations at WFP Nutrition. We have Patrizia Fracassi, Team Leader of Nutrition Policies and Programs in FAO, and we have Angela Kimani, who's a Nutrition and Resilience Consultant at FAO. And finally, Caroline Wilkinson, Senior Nutrition Advisor at UNHCR, is on standby to handle any particular questions and maybe a couple of reflections on the gap on wasting from the perspective of UNHCR. So kicking off, how can the gap address the gaps? What I'm going to run through in this presentation is share some of the priority areas that came out of our special edition on continuity of care, Field Exchange 60, and on actions to improve continuity of care for wasted children. We're going to consider how the UN Global Action Plan on Wasting Framework, or the GAP framework, addresses these priority actions, identify areas of progress and clarification for the gap in child wasting, and with particular reference to the roadmap for action, and then have a UN panel discussion around this. Just a quick note on Field Exchange for those of you who may not be familiar with it. This is an online and print technical publication on nutrition and food security in emergencies and high burden contexts that is produced by ENN 3 times a year. And our aim is really to fast track learning and documentation through publication of programming experiences in the form of field articles and relevant research. And in July 2019, we produced a special edition of Field Exchange on the continuity of care for wasting management. And whilst continuity of care bridges both prevention and treatment of wasting, we particularly focused on continuity of care for the treatment of children with wasting in this edition. And we considered that continuity of care provides any wasted child with appropriate timely care to enable full recovery, and that this requires comprehensive and aligned policies, guidance, financing and programming to ensure adequate and appropriate and accessible services. In essence, our edition found lack of continuity of care for treatment of wasted children. And you can read the details of what we found in an extended editorial that we produced in the special edition. However, reflecting on our findings in our editorial, we identified 3 particular priority areas for action. And this is what they were summarised. First one UN agency should be designated with overall authority, responsibility and accountability for wasting management. We needed dynamic leadership by WHO to coordinate research and generate normative guidance for the treatment and care of at-risk infants and children. And an urgent review was needed of the extent and nature of ready-to-use food supply challenges to inform how they can be collectively addressed. Now, this edition in July 2019 coincided with efforts by donors, governments, UN agencies and the wider nutrition sector to explore new ways of working and programming design, recognising that change was needed in the way we did business in order to improve our management of wasting. And when we produced this edition, we shortly later convened with the Eleanor Crook Foundation a donor roundtable meeting in London, where we shared our findings and priority actions. And the priority actions that we identified also contributed and informed 2 letters that were sent to the UN Secretary General, one from core philanthropic donors who are invested in wasting treatment, and the second by 45 signatories from civil society that was sent towards the end of last year. 8 months after we released our edition, The Global Action Plan on Child Wasting Framework for Action was released by the 5 UN agencies that are represented here. And together with the Roadmap for Action, which will be a UNICEF-led collaborative initiative, these together will form the GAP on child wasting. The common focus this GAP gives is really aims to guide individual and collective action to support countries in a more unified response to wasting prevention and treatment. It adopts a life cycle approach that focuses on mothers, infants and children, and it encompasses both prevention and treatment of wasting. And the GAP is configured around 4 key outcomes with 43 essential actions associated with it. So the first is reduced incidence of low birth weight through improved maternal nutrition, improved child health by improving access to primary health care, to water, sanitation, hygiene, and enhanced food security and food safety. Improved infant and young child feeding through improved breastfeeding practices and child diets in the early years of life, and improved treatment of child wasting through strengthening health systems and by integration treatment into primary health services. And the aim is to increase coverage of treatment by 50% by 2025. So what we did is we took our field exchange priority actions and some of the details underpinning them and had a look at the GAP framework to see whether they were addressed or whether there was areas that needed more clarity or perhaps further action. And this is what we're going to share with you today. If we take our first action, one UN agency should be designated with overall authority, responsibility and accountability for provision of wasting treatment. We considered that this did not preclude operational and normative roles for the other UN agencies. It must provide coherent and comprehensive data on continuity of care provision. It should provide clarification on UN agency operational and normative mandates and ways of working together. And any inter-UN initiatives to address wasting, such as the GAP, should be subject to external multi-stakeholder and expert peer review. When we looked at the framework, we were heartened to see significant development. And it states that UNICEF will be the lead coordinating agency at a global, regional and national level for the operationalization of efforts to prevent and treat child wasting in all contexts. No details, however, are provided on authority that's vested in UNICEF and accountability of this leadership role. And the GAP does commit to an accountability mechanism with particular reference to the roadmap, but does not provide details on the modality and the scope. Broad UN agency roles are outlined along existing mandates, but there isn't any particular provision for a review of existing mandates and ways of working. And there are no details in the framework on the how of working together. So there's reference to the UN agencies will lead and coordinate their efforts, which suggests that this will require consensus. One of the issues we identified in our field exchange 60 edition was around the management of complicated wasting. And in countries, management of complicated wasting and severe wasting was managed by WHO, or where WHO didn't have capacity, then it was overseen by UNICEF. And there was no mandate or clear way of working and supporting children who were medically complicated, moderate cases of wasting. The current framework implies that UNICEF has a UN operational responsibility for complicated case management of wasted children, and there's no specified role for WHO in the framework in this regard. The framework also talks of a need to strengthen national health information systems to report on wasting and related data. However, UN data continuity and availability is not addressed. And the GAP framework development did involve some external consultation. So there was several regional workshops, there was a consultation in Geneva, and there was a consultation in New York in late 2019 involving some civil society partners. But the process was not particularly transparent nor predictable. In terms of our second action, leadership by WHO to coordinate research and generate normative guidance for the treatment and care of at-risk infants and children. We considered we needed a dedicated body of coordinated research across Asia and Africa that considered the risk profiles of infants and children and took account of national resources, health systems, and broader issues like livelihoods and social protection. We needed normative guidance that considered not only the technical details, but the cost effectiveness, sustainability, and scale. And critically, we needed a process for rapid or interim guidance and clear plans for rollout and uptake of what guidance was generated. And finally, in order to deliver on this, we really needed to address the recognised shortfalls by WHO themselves in their capacity at international, regional, and country levels. So what did we find? When we looked at the framework, again, we were heartened to see that WHO is identified as the lead agency at global, regional and national level to coordinate and oversee the generation of new evidence to address gaps and to develop normative guidance and tools for governments. And there are targets included. So we should see prevention and treatment of wasting guidelines produced by the end of 2021 and an update of national guidance to follow by end of 2023. And the framework also refers to a WHO-led accelerated guidance process for operational and short-term normative guidance actions. The framework says that WHO will consult with national governments, academics, donors and other stakeholders to inform regular updates for the global community, and that a research agenda will be further detailed in consultation with key stakeholders. Now, it's worth noting in the framework there are some research priorities and specific research questions are included, but the exact sources are not given. And detailed scope of the guidance and process and schedule to get us to the 2021 and 2023 targets are not currently included in the framework. Finally, our third action, with an urgent review of the extent and nature of ready-to-use food supply challenges to inform how they can be collectively addressed. The GAP framework notes the need for key nutrition products to be routinely available and managed as part of national health systems, encourages countries to include RUTF into essential medicine lists, considering what is contextually appropriate, notes the need to streamline supply chain systems for the delivery of nutrition products. But the problems with current UN supply chain system aren't recognised in the framework. It's unclear whether UNICEF's overall responsibility extends to supply chain integrity, and individual UN agency responsibility and accountability for product supply is not specified in the framework. So in essence, when we looked at the GAP framework, we saw considerable progress and a great direction of travel. We have 5 UN agencies committed to working together. We have designation of UNICEF as the lead coordinating agency to operationalise prevention and treatment of wasting. We've clear WHO leadership to coordinate, deliver and support generation of evidence and timely global and country guidance, and greater alignment of prevention and treatment of wasting programmes to support continuity of care. We want to continue this progress, and this is why we have convened this webinar today. There's an opportunity and indeed a necessity for some more details and clarity on how to deliver on the framework's ambitions. The stated principle of the framework to promote government leadership and ownership is very welcome, and indeed is reflected in the plans for the UNICEF-led roadmap for action that will be developed through country-level multi-stakeholder consultation. And this should enable prioritisation by context and could indeed inform a global prioritisation of the 43 actions that are currently included in the global framework. In these country consultations, it will be important to consider how wasting management plans are reflected or should be reflected in national costed plans and in government financing mechanisms. And indeed in many protracted, fragile contexts, this will require a shift from shorter, more humanitarian funding to longer term financing and indeed government financing arrangements. And it's worth noting that whilst the principle of the framework is to promote government leadership and ownership, there's no stipulation or provision for government authority over UN responsibilities and ways of working at country level. As we reflected on our reflections on the gap and the field exchange edition priority actions, we've identified several clarifications and outstanding actions which we thought useful to share in the context of developing the roadmap and what is considered there, and also might need a bit more global consultation to address some of them. There's a need to establish an accountability mechanism for UNICEF as the overall coordinating agency and for the respective UN agencies, and this should include stakeholders independent of the UN. We need clarity on what decision-making authority is vested in UNICEF's coordination role, and clarity on whether UNICEF and or WHO is responsible for programming related to the management of complicated wasting. We need a detailed plan and schedule for WHO guideline development that includes the exact scope of the guidance, the schedule to deliver on the 2021 and 2023 targets, the process for interim short-term guidance, and a mechanism for development and delivery of a coordinated research agenda. And we need commitment to and clarification of lead agency responsibility for harmonised, comprehensive, transparent data across UN supported services. The framework and what's outlined in it in terms of UN operational roles and responsibilities reflects really doing what the UN currently does better rather than doing it significantly differently. And no doubt the ways of working will be informed by the roadmap development. And indeed that might throw up some issues that may warrant considering a UN mandate review. And if there were to be such a review, it would really benefit, we feel, from a documentation of what the current process is for mandate development and update at the UN. And any subsequent update should involve an independent external review. And finally, we still feel that there is a need for an independent review of ready-to-use food supply chain management across contexts to shed light that can inform and indeed help reform UN supply chain system and determine agency responsibilities and accountabilities. To finish, gap on child wasting is really an unprecedented multi-UN agency owned action on wasting prevention and treatment, and is so welcome. The GAP framework shows good progress and direction of travel, and the GAP roadmap for action offers a great opportunity for us to work together to deliver on it. And what we will need in order to make the most of this is a transparent process and timeline to maximise multi-stakeholder engagement that includes government, civil society, funders, the private sector, and regional and country programmers. Thank you very much, and I conclude my presentation, and I think we just have a couple of minutes now for any clarifications specific to this presentation, and for that Jeremy Shohan, my co-editor at Field Exchange, will join me. So any discussion points we will keep for the UN panel discussion. So this is for any clarifications at the moment. Pop them in the chat box and Natalie can pick them up. I'm having a little look at the chat myself just to check.
Hi Marie, there's just clarifications on the gap, which I think that will be addressed in the UN panel discussions. So perhaps we should answer those afterwards.
Sure, and I think there's just, I can just see one here about just the gap, talk specifically about the under 6 months age group. So it encompasses that age group within its scope. Just quickly looking. Great, well, if there's no clarifications, that gives us more time and we can be right on schedule. So what we'll do now is we will move on to the UN panel discussion, and the UN will just activate their their videos and their microphones, and Jeremy is going to come online to chair this session. So I'll give everybody just a few moments to get online. We can see all who's joining. Welcome all. So just checking we've got everybody on. Super. So over to you, Jeremy. I'm just going to try and move my...
Thank you, Marie. That's great. Thanks for the
Right
presentation. Can I be heard?
You can be heard and you can be seen.
Excellent. Great. Thank you. Thank you, first of all, to our illustrious panel for showing up for this webinar. I think it's a great opportunity to provide some of the clarification that Marie has asked for in this presentation. And the way we're going to do it, we're going to start off with UNICEF and then move on to WHO, WFP, FAO, and then there's a general question. And as Marie said at the beginning, the panel have seen the basic questions. I'm going to ask them and maybe add a little bit of context where necessary. So for UNICEF, that's Saul and Victor. First of all, welcome, thanks again. We have three main questions for you guys, and I'll leave it for you to fight amongst yourself who answers. The first question really comes back to the question around this leadership coordination role and authority invested in UNICEF. And I think for a lot of us, it would be great if we could have a little bit more granularity and detail on this role and how it's going to be exercised. So for example, how will the role be different to UNICEF's current role? And can you say something about how UNICEF will be accountable for fulfilling this role? And at the same time, ensure accountability of other partners, other UN partners. So take an example where there isn't consensus between UN agencies or alignment at global and country level, and it becomes problematic. What authority will UNICEF have to resolve that? And will there be any element of independent stakeholders involved in ensuring this accountability? So that's one question. There are two other ones which are more straightforward, if I may, if I'll just follow on with those questions immediately. Obviously, the development of the roadmap has been to some extent constrained or stymied by the COVID crisis, and that's a spanner in the works. But can you tell us something about how you see the timeline and process now for the finalization of the gap? Perhaps say something about the plans for the country level consultation, and also how and whether civil society will be engaged in the roadmap development. And the final question comes back to the issue that Marie raised about the ready-to-use food supply challenges that for many years we hear about anecdotally. The question really is, are there any plans for a review of these challenges and how the roadmap might be able to address challenges that are identified, particularly in terms of agency roles and responsibilities? So over to you, Saul and Victor.
Hi, Jeremy, can you hear me? Let me first check that my sound is appropriate. Can you hear me?
Yes, very well, thank you.
Excellent. So thank you, colleagues. Thank you, Jeremy. I'm extremely pleased to be with all of you today. Extremely impressed as well, Marie, Jeremy, that we have so many people attending, over 150 if the counting is right. So that I think is an expression of the huge interest that everything wasting has in the nutrition community, everything prevention and treatment of wasting. So let me try to be brief. I'm going to take the first question, which, as you said, might be a little bit more complex and a little bit overarching, and then Sol, who is your colleague, will take the second two, which number 2 and number 3, which are a little bit more specific. So the first question is about leadership, it's about accountability, it's about consensus and alignment. So those are not easy issues to respond to, but the first thought that comes to my mind is for us to be very clear that the Global Action Plan on Child Wasting already defines quite clearly roles and responsibilities, or at least default roles and responsibilities of each one of the UN agencies. Of course, that document would not be 100% comprehensive, but I think it does provide enough clarity to give a sense of what is the demarcation and what are the roles and responsibilities and therefore accountabilities. So I would say that the primary role of UNICEF is a role to drive and support the development of this global action plan at the country level. And a lot of what I'm going to be saying right now is trying to help us visualize what is really going to happen at the country level, because at the end of the day, if we truly are to say, reduce the number of children in need of treatment by 50% and increase the number of children treated by 50%, that needs to happen in very specific countries, in very specific contexts. So it is no longer a theoretical discussion, but a discussion that needs to take place at the country level. Therefore, UNICEF will play a key role, I hope, a key role in developing the roadmaps, and Sol is going to be giving us a little bit of information about the timeline on that. Each roadmap in every country is going to be very clear about the vision, the goals, the objectives. So it needs to be very country specific, cannot be theoretical. But it will also clarify the roles and responsibilities at the country level. I did make a reference before that the Global Action Plan does provide with a definition of the default roles and responsibilities. And those default roles and responsibilities are, in theory, that is given mandates, given expertise, experience, and appetite to do things. Then we will need to identify in a given country what is the human resource capacity, what are the technical capacities, what are the logistical capacities, the operational capacities, and therefore at the country level define roles and responsibilities. For us in UNICEF, our role as a convener at the country level is to make sure first and foremost that governments are in the driver's seat. That is, there is no success of the Global Action Plan on Child Wasting if it is not owned by national governments and subnational governments in many countries, and if it is not driven by governments. So for us, that is going to be a key area of emphasis, not driven by UNICEF, but driven by governments. And we know that that takes different shapes and different forms in different countries. But governments in the driver's seat need to be a key feature of the Global Action Plan if the Global Action Plan is to be successful. In that roadmap at the country level, there will be, as I said, vision, goals, and objectives. There will be a definition of roles, responsibilities, and there needs to be an accountability framework. That is, there needs to be a commitment to deliver on roles, responsibilities, and commitments that each agency, each stakeholder has. And I think in that there is a significant role for independent stakeholders, that is, groups of people, organizations, or others, including civil society, that will hold all of us accountable. Jeremy, you did ask about leadership and how I see the leadership of UNICEF. And of course, I always make a difference between authority and power. We don't have the power to dictate what other people should or should not be doing. And I'm happy that we don't have that power, actually. I do think that we have been given the moral authority and the operational authority to convene and coordinate. So in some sense, I would define the role of UNICEF as, in Latin, we would say primus inter pares, that is, as a lead among peers. We are a peer, but we have been requested to lead this global action plan. And I think that in that sense, our role at the country level in coordinating prevention and treatment efforts is similar to the role of WHO in developing the framework. That is another example of a lead among peers. WHO has played a major role in that. So I think that leadership role is given to us, UNICEF, for three major reasons. One is obviously our mandate for children, our mandate on nutrition, and our mandate to coordinate sector sectoral work and cluster work. I also think it is given to us because of our footprint that is being present in more than 130 countries and having nutrition programs in all those countries. Programs that focus both on prevention and treatment and the continuum of care for children. And I think it is also given to us because in most of those countries, and I hope in all of those countries, UNICEF is a trusted advisor to the Ministry of Health and government. So I think it is a big responsibility that has been given to us, and a responsibility that we can only deliver on if we are supported. That is, we cannot deliver on this responsibility against peers. We can only deliver on this responsibility with peers, and peers means the UN agencies, but also beyond UN agencies. At the country level, I see two major layers of work for UNICEF. One is at the level of our country representative, and it is extremely important for all of us to understand that if the global action plan is to be successful, it should not be the issue of nutrition specialists and nutrition technical people only. We need to bring on board the political leadership and the leadership, including in our agencies. So I do see a role for our country representatives in the countries where the global action plan is going to be rolled out. What is the role of the country representative? The relationship with the government at large, the relationship with the Ministry of Health whenever that is needed, other ministries, convene the UN country team and make of child wasting an issue of discussion, an issue of advocacy, an issue of policy influence. So that is the role of the country representative and our senior leadership in country. And then there is, of course, a major role to our technical teams. The lead, UNICEF nutrition lead in every country will be the one responsible for convening technical and development partners, will play a major role in providing technical support and a sense of strategic direction and choices. Finally, a word that is very close to my heart, Jeremy, if I may, in my last minute, is that I think a key role of UNICEF, and in learning from the process that we have undergone for the development of the Global Action Plan, and we saw some of the gaps of the Global Action Plan that Marie was sharing with all of us, is that it is our role to instill a sense of urgency and feasibility. It needs to be done, and it can be done, and many things will be important, but not all things are equally important. So first, as I said before, put national governments in the driver's seat. To me, that is a key issue. It is an issue of ownership, and it is an issue of sustainability. Then convene partners, including UN partners, around governments and children, not around our mandate, but around governments and around children. Help contextualize. As I said, many things might be important, but some things are going to be essential. Therefore, there is a hierarchy and a sequence, and UNICEF will play, and I'm very committed to that, will play a role in helping prioritize and helping establish that hierarchy and sequence of the things that need to happen. Not everything can happen at once, not everything can happen overnight. Some things need to happen sooner than others, and I think UNICEF will need to play a role in that. So there is a short term, there is a medium term, there is a long term, and it is extremely important that we make sure that we aim for good and we don't aim for perfect, because if we aim for perfect, we could fail. So context, identifying context and contextual priorities is something that UNICEF will need to play and will play a role, and I'm very committed to that, a key role, contextualizing, prioritizing, and instilling a sense of urgency and feasibility. Let me now hand it over to Sol for more specific details about timelines and the RUTF question. Sol, over to you.
Jeremy, you're on mute.
Victor, thank you very much for such a comprehensive reply. I just want to follow up with one very quick question, if I may, before Saul. Such a comprehensive answer, and two phrases that really struck a chord: government in the driving seat, lead amongst peers. Question to you, if you could try and answer this as succinctly as you can, what will be different about the way UNICEF will work under the GAP?
I think a number of things will need to be different. I want to go back to what I said. We can only lead if we are supported to lead. And sometimes in the past, perhaps we have been requested to lead, but we have not been supported to lead. So the first thing that needs to change is that we be supported to lead, one, and two, that we do not shy away from our leadership role. In some instances, we might have forgotten or procrastinated our leadership role in the past. So it is both sides. I think what needs to change and what will be different is our resolve to lead, one, to the fact that, as I said before, it will not be only the role of the technical teams of UNICEF, but the role of the UNICEF leadership in the country. And in that sense, our senior leadership in UNICEF in New York has already communicated with the country representatives in those 20 countries that we have identified as front runners, key countries, if this is to be successful. So I think that is going to be different. Three, that I feel vested with the authority and the expectation that we need to lead, and that gives us, or at least gives me significant authority, moral authority to say we have been requested to lead and therefore we can lead and we need to lead, and we will.
Okay, thank you. Saul, over to you.
Yeah, so maybe to start off with the question around the country roadmaps and the operationalization of the GAP framework that was released in February. Our original plan when the GAP framework was released was to have the country roadmaps developed by the end of July, so available around August time, with an eye on then spending the last half of the year really building sort of momentum and support for that operational roadmap in the lead up to Nutrition for Growth in Japan in December. And then COVID happened. And with COVID, you said that it was that you anticipated some disruptions. Well, I mean, I think that might be a bit of an understatement insofar as I think everything has shifted, including, of course, Nutrition for Growth happening now in 2021. And I think that the way that this has impacted this process, I guess, is some things have stayed the same and some things have changed. So what has stayed the same? We're still focusing on a set of front-runner countries across Africa, Asia, and Latin America. And really the focus is on countries where their wasting is a significant problem, but where there's also opportunities or reason to believe that there is a government commitment to try to address that on a systemic and sustainable way. That list of front-runner countries currently includes about 20 different countries where we are currently in discussions with different parts of different UN agency representatives just to get that list finalized. But so that part hasn't changed. We still have a sort of a subset of countries where we're going to focus most of our efforts. What has changed is that in the original time frame where we were going to have all of this sort of finalized by August, we would have had no time to prep. We would have had to go directly from the GAP framework that was released immediately to country conversations with the government without any opportunity to really prepare the groundwork for those conversations with the countries. And therefore, I think those conversations would have been somewhat rushed if we were going to be able to finish them on time. Now, with the additional time that we have in effect gained as a result of what's happening with COVID, what we have done is decided to spend a lot more time now really doing our homework on this. And what that means really is right now, we're working really closely with all of the UN agencies, right? It's not just a UNICEF endeavor, it's an endeavor where FAO and WFP are taking the lead in mapping out everything that has to do with food systems and social protection systems, whilst WHO and UNICEF looks at everything that has to do with health and watch systems based on the GAP framework. And what we're asking ourselves is, what are countries already doing against the 40 actions that were defined in the GAP framework, right? So if you take the front runner countries and you look at the 40 actions that were the potential actions that were listed in that framework, we're asking ourselves, where are countries at? Because what we don't want is the GAP to become yet another strategy, yet another framework for the government. What we want is for the GAP to be an opportunity to say three things to countries. Either you're already doing some of the things that we believe are necessary to move the needle when it comes to wasting, right? So to use the GAP as an opportunity to reaffirm some of the government's commitments and action. Two, to identify opportunities to modify or calibrate some of the commitments and actions that governments are already taking to say, well, maybe we can aspire to do more. Maybe we can be more ambitious in what we're trying to do. Maybe we can, minor modifications here or there that would have an impact on wasting. And third and lastly, an opportunity to identify gaps in what countries aren't doing that we feel are necessary. So to be able to take examples of those three things that are being done, things that are being done but should be modified, and things that are not being done, and really make that the foundation on which we have these conversations with the country. So our hope right now is to have this provisional preliminary mapping of where countries are at for all of the front runner countries by August, so that we have this mapping, this common starting point for every country by the end of the summer. And we can therefore allow countries, we give more time to countries to potentially be in a position to initiate this dialogue in the last half of the year. And then take this conversation immediately to country, to the governments right away, so that we can say, here's a set of things, here's how the picture as we see it emerge. Where do you want to take this conversation? Because as Victor says, this isn't a UN-led plan. This is not a UN plan, this is a government-led plan. And our hope is to be able to facilitate that conversation with governments about what governments want to do in their own countries to move the needle. The way that we see our role in those conversations is to put forward some of these recommendations where, based on our perspective and expertise, some of the recommendations that we would make to countries, but let that process from then on to be led by governments. However, in defining those actions, what we anticipate will happen is that government will say, well, we want to move forward with this, and that. But in order to be able to do so, we are going to need UN agencies to do X, and civil society to do Y, and donors to do Z, right? So that they can turn back to us and say, this is what we need from you in order to be able to make these commitments. And in as much as we make those supporting commitments, that becomes our accountability framework. Because if UNICEF in Ethiopia says we are going to do X in support of the government, that becomes what we're accountable as an agency in Ethiopia. And the same for every donor, every civil society organization or the UN agency in that country, but under a government-led framework. And our hope is to really be able to do all of that and finalize all of that by the end of the year. That continues to be the timeline in which we're working. At the end of the day, though, it will be irresponsible for us to really try to ram this through in context where we know national governments are right now have their hands full in trying to deal with COVID. So we're going to have to play it by ear to some degree, right? And be sure that when we are having these conversations with countries, is at a time that works for them, not just that works for us and our sort of desire of having the roadmap finalized by a particular time. I'm happy to talk about the question around RUTF if you want me to move on, or
yeah. So if you could just do that really quickly, 2 minutes.
Sure. So yeah. So I guess the questions around RUTF. There's three sort of things that I think we need to figure out on this process, because I think when we talk about the challenges, it's very easy to talk about certain aspects of the supply chain management, but I think that the pictures it needs to be addressed more comprehensively. First of all, who needs RUTF, right? I think our current normative guidance stipulates that not all children who are wasted need LNS or RUTF. So what we first need to do is to make sure that we have a super clear picture and consensus around who needs RUTF, so that we can then make a better stipulation of how much RUTF needs to be available in the first place, right? And so we're working really closely together with WHO in reviewing a lot of that, and how our evolving understanding around risk and wasting should inform sort of which profile of children needs RUTF and which would benefit from a different support regime. The second question is, what RUF is needed, right? Our belief in doing this or moving this conversation forward is that there is a proliferation of products happening right now, and we believe that we need to start turning that back around and actually start moving towards a simplification the range of options and potentially land on a single product that can be used in different ways to treat different forms or different stages of wasting. And I think that a lot of the emerging evidence sort of points towards the viability and the effectiveness and cost effectiveness of that approach. And finally, and I think that that's where we start getting into supply chain management, is answering really the question of who should be in charge of our UTF procurement and management. What I think we believe in, and I would like to believe that everybody on this call would agree, is that the world is not asking for more UN involvement on the supply chain management of our UTF. The world is asking for less UN involvement on our UTF management at a global and national level. So the question is, how can we start empowering governments to manage this commodity in the same way that every other medical commodity is managed? And that means putting it on the essential list, putting it in their sort of procurement systems, and at the same time recognize what added value can the UN bring, where and when, in order to continue to support governments ensuring that there is sufficient amounts of this commodity in the right place at the right time. But so there is no single challenge. There's a set of challenges that I think we need to address simultaneously, but with the end goal of seeing this product being managed by governments like any other commodity, recognizing that the UN will probably still have an added value to bring into that picture.
Okay.
Over.
Saul, thank you very much. Just a yes or no answer, if I may, from you, please, or Victor. You said I think the roadmap will be finished by the end of the year, or is that the country consultations by the end of the year?
The roadmap.
The roadmap. Great, brilliant. Okay, I'm really sorry we don't have more time to explore some of your answers. Very interesting though. We're just limited with time, so thank you, Team UNICEF. And Marie, over to you for, I think, WHO questions. You may be on mute, Marie.
I am indeed. Sorry. We go. Hi, Francesco and Zisha. So similar to Jeremy, I'll ask you a few questions in the one breath and then let you handle them amongst yourselves however you seem fit. So the first one is, would you be able to share any details on the scope of the guidelines that you will be developing around wasting management? And related to that, when will a schedule and detailed plan for the development be available, and one that includes the plans for interim guidance development? So in addition to the longer term normative guidance, the process for those kind of more rapid fire interim operational guidance that there's a real appetite and need for. Regarding evidence generation, which we know is critical to generating the guidance, how is WHO planning to coordinate the research agendas? We see many research prioritizations and groups, etc. So that's going to be quite a task. The current financing environment is challenging at the best of times, and particularly so in the light of COVID, I guess. Is WHO facing any challenges in resourcing and capacitating to deliver on all that is committed to in the GAP on child wasting? And then finally, one sort of technical question, if you'd be able to clarify which UN agency is responsible for supporting the management of complicated wasting at country level. So I'll hand over to you now, and you take them as you feel right.
Thank you very much, Marie, and I really am grateful to ENN for having organized it, and particularly for being so clear and to the point with the questions. So we'll be as clear and to the point with our answers. So on the guidelines, we were very fortunate to have in December 2019 a technical consultation on the prevention and treatment of wasting that brought together program and research experts and operators. And that gave us a good scope of what was needed, first of all, to finalize the Global Action Plan framework, and then to identify what were the key issues that would have to be addressed by the WHO's guideline development work. So we've reflected on those discussions, and we've now defined basically 5 areas for guideline development. The first area is about the identification, diagnosis, and recovery of children with wasting. And here we would like to introduce a risk approach. So we need to identify the children at highest risk of mortality and at risk of deterioration of nutritional status going beyond anthropometry. And of course, we need to operationalize this risk assessment in different contexts, in the community, in the facilities. And we need to clearly define what sustained recovery means and how we measure it. Second area is about the treatment of children with wasting. And here, first of all, we need to consider a broader concept of wasting. So not just a severe one, but the broader, moderate and severe, and consider what kind of medical and nutritional care is needed for children with different categories of risk of wasting. So this means that children with the highest risk would need to have medical care in addition to nutritional care. This is also the issue around the complications and what basically requires children with certain conditions, independently also from anthropometry, to be admitted to facilities. And then, of course, what should we do with children with which can be kept in the community and can be treated as outpatients? What kind of not only food support, what kind of supplementary food support might be needed, what kind of counseling, what kind of regular checks would be needed to avoid that those children then fall into a higher risk category. The third area would be specifically about infants less than 6 months of age, and I saw that this was a question that came. Yes, indeed, this is an area that requires much more in-depth guidance. We need to, again, identify which are the children at risk. So, how do you define growth faltering in this group? What kind of indicators? Can we use medium upper arm circumference as an indicator for screening? How are we going to treat the medical complication? How can we continue to support breastfeeding in this group? The fourth area is around prevention, and the GAP talks about a number of important areas. Here we really need to make sure that we address fully the life course, and we start with prevention early enough. Certainly antenatal care is going to be quite important. How to promote and support appropriate breastfeeding and complementary feeding. When do we need supplementary food and other food security interventions? How can we strengthen social safety nets, cash transfer? What kind of environmental interventions can be put in place, and how they can be combined in comprehensive community packages? The fifth area is really going back to your initial concept, Marie, about the continuity of care. And we need to be clear about how that individual child-centered approach can be implemented. How can we make sure that a child receive adequate attention from conception, that adequate prevention measures are in place, but if those fail, an adequate system is in place to look after the child and trying to avoid her or him to go in a further level of severity, but then making sure that even after the hopefully temporary measures in place in a facility or in a community, that child is not then left again behind with the risk of going again in the category of those who need again treatment. So the outcome of all this should be sustained recovery, and that of course has important operational implication, and it dovetails with the discussion on how we do it and how we organize it in practice. Now, Zita will tell you more about how we're going to do it and what's the timeline. So over to you, Zita.
Thanks, Francesco. Thanks, Marie. Now to the timeline. We are currently trying to capture questions under the 5 areas that Francesco mentioned. We are discussing it together with other WHO colleagues and other departments. The plan is to have a WHO steering group meeting with the other departments. Very key, of course, is the maternal child health, but it's also health systems, it's the emergency group, the communicable diseases, non-communicable disease people, and so on. In August this year, and this is to discuss the scope in more detail and the questions. And a very important step is to discuss the guideline development group members. The guideline development core group members, we will, the suggested members will have to send in their declaration of interests. We aim to publish that list online by end of August. There will be different experts and members that will be needed and pulled in depending on the topic and the work streams that we will be having. There will then be a scoping meeting. The aim is to have that meeting in September, the week of September 22nd. More than one meeting will be needed given the large scope of this comprehensive guideline. The scoping meeting is where we will be discussing the questions in detail. That will be part of the guideline. In October this year, we aim to finalize the PICOs, the questions, and submit a call for authors online to look for authors who would be willing to do systematic reviews based on the questions identified in the scoping meeting. By December this year, we aim to identify the authors and commission the systematic reviews. We usually give, we will not give them a lot of time actually. The systematic reviews will have to be completed in a six-month period, which means July 2021. And the guideline development group meetings, which will draw on the evidence collected in the systematic reviews, where we then formulate the recommendations, will be held between September and November 2021. Again, there'll be several guideline meetings based on the different work streams and the topics that Francesco also mentioned. So that brings us then to December 2021, when we will have draft recommendations available and submitted to our GRC. The GRC is the Guideline Review Committee of WHO for clearance. Yeah, this is the timeline. Back to you, Marie or Francesco.
Great.
Yeah, maybe I'll continue, Marie, if you're
sure.
With the other question. Also on the guidelines, I'd like to add that you appreciate where we've decided to bring everything together. So we will not have separate guidelines. We will have actually a bundle of guidelines. Some will be based on you know, the new systematic reviews, but some also will build on existing guidance. So I think, you know, one of the question in the chat was, you know, what about the prevention? There's a lot of things we already know. You don't have to reinvent them. Of course, you know, that will be linked together in what we call the derivative product. So it's, you know, still part of a comprehensive guidance, but we don't have to develop new analysis on that. And also another point I'd like to make that, you know, in WHO we're now moving in towards what we call the living guidelines. So basically, this is not an exercise, and then we'll have to wait until you know, the next 10 or 15 years to redo it. But this will be completely updated, and you know, we'll try to build this continuous update in the process now, so that, you know, whenever new research, new evidence, new experience, new needs come, we're able to swiftly add them. Now, on the second question, which is the research agenda. Clearly, you know, research agenda is critical because, you know, we need that research to inform the guidance, and, you know, we need, of course, existing data sets, existing intervention studies, program evaluation, particularly when it comes to operational guidance. I must say that we're not moving in a vacuum. And I really would like to acknowledge the work that ENN does in bringing to the surface a lot of very interesting experience. And just to quote some, we have the chain network, the knowledge integration initiative, the ENN waste initiative, the action against stunting hub, the MAMI project, just to quote some. So first step would be to map the existing collaboration and initiatives. And then, yes, of course, with partners, convene to connect, to create exchange, to create synergies. In some cases, we're faced with challenges because when we are analyzing studies and we do systematic reviews, the protocols are so different to bring them together. And so, efforts which could have been coordinated efficiently to scale up the responses are actually uncoordinated and not necessarily as effective as we would like. So definitely an effort there. So we'll make a plan about that coordination. The kind of research, of course, is different. So in some cases we have really the randomized controlled trial that are addressing fundamental research issues. But then there's a wealth of research, very important, which is the operational research, which is helping us on the delivery options. And that, of course, will need to be based a lot on the programmatic experience. And then there's the new research. There's a new research, and here's particularly the whole coordination work will be led by our colleagues in the WHO Maternal, Newborn, Child and Adolescent Health and Aging Department. So we're discussing with them where to start. But in terms of new research, one of the things that was points what was mentioned in the chat, about the use, for example, of locally available food versus the ready-to-use supplementary food, particularly in children with illness. That's an area of research which might come. Another important area, it could come around the management of growth failure in children less than 6 months. That's definitely an area where we would need more data. And then, as I said, new research, and here's where, again, a synergy with partners, particularly with our sister agencies, and particularly, I would say, UNICEF, the operational research. There's a number of questions where, they have identified very important and useful suggestions, which we hopefully will be able to build on. Now, on the third question about the capacities, this is, of course, everybody is aware of the challenge, particularly WHO is having. We're having, great support by a number of new donors who are stepping up to support the operational challenges that WHO might face. Well, first of all, we have to be clear about what the needs are. So we developed an analysis of our resource need, particularly to deliver on some of our key objectives. So the guidelines have to be delivered. So we need to do everything to make that happen in terms of systematic reviews or products that we need for that, but as well as the staff in WHO. I would say, so we have that overall project, and we're happy to share with all our donors. In fact, we really like the idea of pools of donors, and then we want to have full transparency and accountability to them. We're grateful to those who have stepped up. Of course, one of the big challenges will be a bit later down the line at the national level when it comes to transfer adaptation of guidelines. But that's where we see, really partnership at the heart of our theory of change, and particularly complementing with sister agencies and partners. So yeah, we will need additional resources. We're not there, but we're getting there. Particularly, we're clear of what exactly we need. Final point on the services for complicated wasting. I'd like to start saying that country roadmaps will indicate the needs and clarify the roles and responsibilities. And what we want to do eventually is to best serve the children, and that will be we'll have to see what capacity WHO has there versus the other partners, and certainly particularly UNICEF. We've always been working together. And maybe I just wanted to ask Zita to tell us how we've been working together, and some examples of this synergies. Over to you, Zita.
Sorry, maybe just to say we are running close on time, so Zita, if that could be very, very brief, because we just need to allow time for the other UN agencies also.
Okay, fine. Just a minute. Well, I mean, what we've been currently doing, I mean, it's clear that WHO, being the normative agency, is responsible for the guidance aspects, and that's where governments come to us when it comes to updating national policies, protocols. It is based on WHO norm standards. We work, of course, very closely together with UNICEF on this. WHO is also very much involved in building the capacity of pediatricians and health workers. We have the WHO training package. What we're trying to do is be a bit more engaged in pre-service training rather than refresher trainings, which is not very sustainable. But we're working on trying to improve a more sustainable way of building the capacity of health workers in this area. Again, very closely together with UNICEF, of course. There's also the medical kit that WHO has developed together with the pediatric kit, very much a health system strengthening tool to ensure that the stabilization centers have the medication in place. In the past, we have, where roles and responsibilities haven't been clear, we've tried to develop MOUs, Memorandum of Understandings, to highlight the roles and responsibilities. For example, Pakistan, there was Yemen, there's a clear understanding now as well, Burundi and some other countries where we've done joint trainings. So it is correct that it really depends on the country. It depends on the capacity of the two agencies and how we work together. A global understanding, a global clarity would of course be useful, and we will be working towards that as we discuss the roadmap. Thank you.
Brilliant. Listen, thank you so much, Francesco and Zita, because you covered a lot of territory and you gave some clarity as well, which is fantastic. So in the interest of time, I'm going to speedy on to the WFP team waiting patiently in the wings and attempt to move my slides on. There we go. And indeed, we just have two questions for you, but they're biggie ones, I'm sure. So Jeremy, over to you now. I think you're going to chat with the WFP team.
Yep. So Alison and Nicola, thanks for hanging on. Two quick questions for you. One is about prevention and the way it's addressed in the Global Action Plan. What do you think is different about this plan with regard to prevention? And what do you think WFP will do differently in relation to this plan? How will they be programming it differently to the way they are currently, or how will they be working differently? So that's the first question. And the second one is a more specific question, really. It's about the join between MAM programming and SAM programming for severe and moderate acute malnutrition. And the question is, how do you think the gap is going to help UNICEF and WFP align better at country level in order to provide that continuity of care between MAM and SAM programming, and what mechanisms will be enabled or be employed to enable a better, more aligned programming? Thank you. Over to you two.
Okay, great. Thanks, Jeremy. I'm going to lead off, and then hopefully Nicola will come in. I guess that to start with on the big question about the gap and prevention, I think that the first thing I want to say, and I do think that the issue 60 and what Ian has said at the very beginning of this discussion, I very much agree. I think that this is a sea change moment. It's very funny how with humans, how quickly we adapt. You know, I was just putting a mask on a small child and they didn't mind at all that the mask was on. And, you know, you would have thought, 6 months ago, it wasn't possible. And I think that people have very much kind of forgotten sort of where we were a couple years ago compared to where we are now. And what I want to say is that the Global Action Plan definitely for WFP, but I think for all the agencies, is really a sea change moment. I think that it's coming together in a different way than we've ever come together before. Because rather than having it be a competitive process where that often results in each agency doing less because of mandate wars and because of space. It's a collaborative process that's enabling each agency to bring
Alison, you've just muted yourself.
I think everyone has been muted.
the host muted me.
Oh,
Oh,
sorry.
yes, yes.
That's all right. All is forgiven.
Not intentional, not intentional.
I guess what I'm saying is that I think that allowing each agency to play to its strengths and understanding that we're not going to be able to solve the wasting issue by just going round and round on questions of treatment. And I really do feel like the space has been very, very dominated by a very small circle of a very large universe, which is around the treatment of wasting. And so the prevention agenda, first of all, is something that there's a lot of contribution, but it brings in both nutrition specific and nutrition sensitive. It allows for other sectors to begin to play a role, as we all know, to deal with some of the underlying causes of malnutrition. So I think that this prevention agenda is very exciting. I think it is very new. It's not new in the sense of the individual actions. I think many partners and many agencies have been doing them, but being able to finally layer these different things. And so one of the things that's going on with the roadmap that we're very excited about is really looking at how health systems, social protection systems, and food systems all play different contributory roles into the prevention and treatment of wasting. And so I think that one of the big pieces that we're looking at as WFP in particular is trying to understand that if you are treating a wasted child but returning them to exactly the same environment that caused that wasting in the first place, then you're going to have this sort of endless cycle of wasting reemerging. So how can we trip that cycle? How can we catch children earlier, ideally before they're malnourished, but even on the malnutrition continuum? And how can we use the different systems? So I think that for us, that's one of the big questions. There's also this obvious recognition now in the evidence that wasting prevention is an entry point to prevention of all forms of malnutrition. We're talking about wasting in the gap, but we're really talking about all forms of malnutrition, because if we do the prevention of wasting right, then we're really preventing all forms. And I think that, again, if you look at FAO, if you look at WFP, if you look at UNICEF, different entry points, different ways that we're coming into the question, but ideally contributing to a bigger whole. And so I think that if you look, there was a question in the chat about what are the activities you're talking about. And I mean, I think a good example, and it maybe is very obvious, but in ensuring that we have a layering of and an alignment of the different interventions, so that the same woman that's getting iron folate treatment also is getting a nutritional supplement, also is getting appropriate counseling, IYCF, that she has a safe pregnancy, and that once the child is delivered, that child is already embedded in a system of interventions that can prevent that child from ever becoming malnourished. And I think that the GAP insists on this, and I think that for us, when we look at even the roadmap work, we're looking at these front runner countries and we're looking at how the systems come together, whether or not the policies and legislation is there, and then whether or not the actual programming treatment can allow for the space for social protection and food systems to play a bigger role in wasting prevention and not just rely on health systems to do that. I feel like with time, Jeremy, that I'm going to be pretty brisk and then hope that if you have follow-up questions, but I really want FAO to have their time as well. And I'm just going to move on. All right.
Okay. Yep.
So
Please.
With the second question, I think that really fundamentally, there's a lot of discussion about mandate creep and about wars, but in fact, we really all want the same thing. We all really believe that we need to have increased coverage, and that means being able to reach more children, more pregnant and lactating women, not less. I think that everyone agrees that any child that needs treatment is going to get that treatment. Prevention, we've already talked about. But I think that from a WFP perspective, another piece on that is this feeling that we might need to be thinking about a less medicalized model where a health system can't reach a community and help them manage uncomplicated wasting. So, for example, for WFP, and I saw there was a question in the chat, for sure, we are really, really feeling focused on the fragile and conflict-affected settings. This is a place where we don't believe that we can fully rely always on health systems and even, unfortunately, the government structures alone to ensure that we are in all geographical areas and that everybody has equal access. And this leave no one behind, this equity that's needed within the treatment and prevention of wasting really speaks to the fact that where you have very good functioning health systems, then absolutely looking at that pipeline to get food to all of the areas and ensure that there is appropriate treatment and counseling is perfect. But what about where you don't have that? What about in places in Yemen, in places in South Sudan, where it's very clear that we can't overly rely on a health system there? And while everyone would agree the health system needs to be strengthened, I think that we need to think about how we can ensure that all of the agencies can play to their strengths. And if an agency is in a particular area and is able to support prevention and treatment, that needs to happen. In terms of our partnership with UNICEF, because I see that there's a lot of questions on that, and this is not some kind of deep secret. Basically, as the gap is moving forward, WFP and UNICEF are absolutely recommitting to our own partnership framework. So over the last year and a half, there's been lots of really, really good deep discussions about developing a framework where we are partnering to end child wasting. That framework is very much like the gap in the sense that WFP continues to accept that UNICEF will play a lead role in the coordination, but it doesn't undermine the fact that WFP also feels that we have a role to play and a responsibility. So we have examples of how prevention and treatment that are complementary and can be aligned are already going on over the last year between UNICEF and WFP, so that a single malnourished child and her family have access to the full range of services. So key alignments that are of interest. Of course, this idea of co-location, the idea of hiring a single partner with a single reporting line, coming together for shared assessments and monitoring of data, doing joint training and supporting community nutrition volunteers. All of these things are examples of where both MAM and SAM treatment is still indicated that WFP and UNICEF are coming together, not in order to duplicate services, but in order to make sure that together whoever requires treatment is getting that full treatment. So I think that's a real commitment. And again, it's especially in the fragile context where we're finding that we need a more flexible approach, and where WFP and UNICEF are trying to figure out how do we work together so that we can make sure that these hard to reach geographical areas are still getting the service they need. And then finally, what I'll say is that with COVID-19, you have really seen that we've needed to be adaptive. We need to look at a new way of working, because here specifically health systems are overrun because of the need to treat COVID-19. And there we're really trying to figure out how can we ensure that there can be more management within the community of acute malnutrition, instead of having to have everybody be funneled through a health system before any services are given. So I think that those are sort of the big pieces, but please, Jeremy, I'll stop there. I'm sure there's questions from you.
Thank you very much, Alison. You've done a brilliant job of summarizing there. Does Nicola want to add anything?
Yeah, I'd love for Nicola to come in. I'm sure that I missed unbelievably important things. Nicola?
No, really. I mean, you didn't miss anything. No, I mean, yeah, I can continue speaking for an hour if you want on this issue, but I don't think this is what you want. So no, nothing to add from my side.
Actually,
thank you.
One thing, Nicola, that I thought you were going to nail me on. One thing that we do want to just raise, and it's very much in this gap and it's in this discussion, which is around maternal nutrition. because it's such a centerpiece of a prevention. But we also, as WFP, this is one of the areas that we feel that we're raising over and over again, which is to ensure that there's also treatment available for malnourished, pregnant, and breastfeeding women. And so that's another big piece. And it's also interesting to see how the different systems can contribute around maternal nutrition. So I just wanted to mention that.
Okay, thank you. Thanks, Alison. And Nicola, yeah, we would quite like to hear you talk for an hour, but unfortunately we don't have the time. Another place, another space.
Thank you.
If it's okay with you, well, and I'm sorry to keep FAO, Patricia and Angela hanging around, but we could move on to a couple of questions for you, which is kind of a continuation on the theme of prevention anyway. So if I could just get those questions up. So really, again, two questions for Patricia and Angela. A bit more detail, if possible, from you on how you understand this gap in terms of FAO's involvement in prevention programming, prevention of wasting. Do you see FAO's role as more policy? Is it more operational? Is it both? Is it guidance development? So that's one question. And the other question is, and it relates to something Alison was talking about, the linkages between prevention programming and treatment programming. But we wondered whether FAO has a framework or a model for how to coordinate and link prevention programs with treatment programs. How do you envisage that working at field level? Over to you guys.
Yes, thank you, Jeremy. Can you hear me?
Yes, very well.
Okay, thank you. So on the first question, I just want to emphasize that our commitments in the GAP framework really reflect that the FAO's work in support of governments on nutrition and food systems, especially in context of resilience and emergency. So we have been fully engaged in the development of the GAP framework. We had discussion on how the priority action in the GAP framework can build on some of the work that we are already doing in support of governments. So this is building on the expertise on livelihoods and preparedness. Now the emphasis here, which is new, or which is really necessary, and I want to reemphasize something that Victor said in the very beginning, is to recognize who are the nutritionally vulnerable individuals. Because FAO works with vulnerable communities, and really to bring that link to the individuals, that risk approach that recognizes that individuals like children and women of reproductive age have additional nutritional needs. That's really something very important. And the GAP for us was extremely important to have this discussion within FAO with colleagues that are running programs on social protection, on emergency, on livestock, on value chain. So really talking about that emphasis on co-location, on targeting, and the importance to bridge food and nutrition security. So the new emphasis, if it is new, it's on the nutritional vulnerability. And so nutritional vulnerability that builds on the importance of strengthening the resilience of the community, because again, as it was mentioned before, our UTF is a medicalized commodity. It's not really food. So we really want to make sure that the prevention is there. And I want to bring the attention to a study from the Tufts University that looks at sub-Saharan countries and over the years with data on acute malnutrition, recognizing that there were 2 seasonal peaks on acute malnutrition. So every year in certain countries, you have seasonality that you need to recognize. So it's not something that is completely unforeseen, but there is a seasonality aspect to that. And that for me, it's super important when we are talking about linking prevention and treatment. So really recognizing the seasonality and the livelihood. And the other example that I want to mention is a project by FAO and UNICEF with the Washington State University on livestock for health research in Kenya with the pastoralist community, where they've been looking at the importance of the hunger gap and the availability of animal milk in certain times of the year. So again, here we are partnering with an organization to ensure that the seasonality is fully recognized and it's addressed. And in this case, what they are looking for is the availability of milk to prevent the insurgence of acute malnutrition, which is a seasonal phenomenon. So if you want, I mean, the framework for me, the GAP framework reflects FAO's work on nutrition and food system. And also it really creates that links between prevention, treatment, and the return of the children into the community. So I just want to pass the floor to Angela very briefly, because she has been looking at the country plan, especially from a food system perspective, to emphasize that, you know, what we are talking about, it's not completely extraneous in the country. So just to emphasize that. Thank you so much.
Thank you, Patricia.
Jeremy.
Thank you. Okay, Angela, over to you.
Okay, thanks. I mean, I'll just take a few minutes just to explain, I mean, what we have also seen and also what FAO is doing in line with that. Of course, as we understand that FAO is working within the food systems and also the whole agriculture sector, and what can be done differently, or what also the organization is doing differently, is also to strengthen those different nodes. If we look at the food security, the 4 pillars of food security, looking at availability, access, utilization, and sustainability, how can we further strengthen those linkages to ensure that when we are talking about availability of food, even the regions that are generally known to be food insecure have adequate food available? How can you ensure that accessibility is not an issue, especially for vulnerable households, as Patricia has said? If you're looking at sustainability, how can we ensure that food is sustainably available throughout the year? Because that is one of the key areas that causes a lot of acute malnutrition in some of the arid regions, for example, in Africa. So how can we ensure that there's sustainable food available all the time, and people are able to access it, people are able to use it well, people have the adequate knowledge to ensure that the food is well utilized at a household level? So those are some of the areas that that definitely are going to be strengthened. And if you're looking at the country, the review that we are doing right now in countries, and we've already done for a few of the countries. For example, we have done a bit of review for Ethiopia, and we are still ongoing with Pakistan, with Philippines, and with Mali. And you see, at least also in most of those policies that are related to agriculture, related to nutrition and food security, there's a lot of intention by governments to really strengthen these 4 pillars of food security, and to strengthen how for example, issues of availability are also linked to access, and how it's linked to utilization at community level, at household level, and to ensure sustainability throughout the period. And of course, as I've said, also the issues of social protection. How can you ensure that the most vulnerable households in the community, who may not at that point be able to access the food that they need, they are well covered by social protection programs? So those are some of the key areas that even as we review the different policies, these are areas that are strongly coming out, and discussions are going to be held with countries to ensure that this is also being implemented at country level. Thank you.
Angela, thank you very much. I'm really sorry that we've gone over time, and 1.5 hour webinars, clearly not nearly enough, but it has been fascinating hearing from the 4 agencies how they see the gap from their perspective. I have one question which I really would like to very quickly ask all of the UN agencies on the panel, and that's because it's so critical, I think, to to our scaling up of treatment of wasting. And in the gap, we talk, or there is talk of increasing coverage by 50%, not up to 50%, but by 50%. Now, wasting treatment has historically been underfunded and largely funded through humanitarian programming. So really a question for everyone on the panel today is there a UN vision around resource mobilization to tackle scale up of wasting treatment? And that is for anyone who feels brave enough to tackle that.
I can start. I don't mean I have a full answer to this question, and I will be very brief because I'm mindful that we are well over time. Jeremy, I think the first question that we need to ask ourselves is, what are the financial resources we truly need? And two, to revisit the model that we have been implementing over the last years. We need to identify first, who are the children who truly need this type of specialized treatment, one. Two, how much would that cost? Three, how do we engage governments to make sure that national budgets contribute to addressing this issue? And four, if there is a financial gap, what is the role of the UN agencies, donors, and philanthropy? We do have, of course, a plan to mobilize resources to support the development of roadmaps and the development of technical support to governments. But I don't think that we have a very clear denominator, that is, how much do we truly need? We cannot continue to operate under the assumption that we will need to treat 47 million children at a cost of $140 US year in, year out. That is over. So we truly need to take this very seriously, do and develop an investment case, but with a very clear understanding of what are the true needs, and therefore what do we want to raise funds for, so that we don't lose credibility. I think some of our credibility is at stake because we keep asking for financing for RUTF and treatment, and we need to stop that way of thinking.
So Victor, if I could just pursue that. That's a really, really interesting answer, and it's lovely that you set it out in that way. But given that many countries now have what are commonly called common results frameworks, expedited by the Sun movement in many cases, how do you see the country roadmap, the country gap, inserting itself into those common results frameworks or nutrition plans? Are they separate, or are they separate, or are they part of it?
They need to end up being the same thing and part of a holistic vision for the country. The worst thing that we could do is think of the global action plan and the prevention and treatment of wasting as that nutrition program that government is not in charge of. That is the nutrition program that humanitarian agencies, UNICEF, WHO, WFP, and others will implement. That needs to stop. That way of thinking needs to stop. We need to make sure that the prevention, early detection, and treatment of child wasting is part and parcel of a nutrition vision in the country, and is part and parcel of financial investments. And in that, this community that today gathers around this table, and all those who would like to be with us but are not with us, also need to do some introspection. We have been contributing to perpetuating a vision that wasting is the form of malnutrition that we treat, forget about it, governments, while stunting is the form of malnutrition that you governments prevent. We need to stop that, and we need to bring these agendas together, and this needs to be first and foremost a government responsibility, to which we contribute and support.
Okay, that's very clear. Anyone else want to add a thought to?
Yeah, perhaps I'd like to.
Oh, sorry, Francesco, go ahead.
Alison,
no,
yes, please.
Just to complement what Victor is saying, yeah, we're basically having a battle to make sure that we can mainstream the management of wasting in health systems. So this becomes part of universal health coverage. And we see that, these services get very easily deprioritized. And the assessment that both UNICEF and WHO have done during this COVID pandemic is that about half of the countries have basically dropped the ball and, seized the services. We are going to face an enormous increase if we don't act on that. So definitely strengthening those services and making sure that they become a priority, not just in terms of financial investment, but in terms of service prioritization and capacity of the health workers.
Okay, thank you. Thank you, Francesca. It's interesting. Alison, you wanted to say something as
Yeah,
well.
just really briefly, just two things. One is that I think that, you know, of course, it had been the intention pre-COVID to be able to have a real proper launch of the GAP and do some, not just resource mobilization, but the general advocacy and get governments behind it. And it was very sad that that didn't get to occur. But just to complement what Francesca and Victor have said, I think that one problem we are seeing is that there is just very low investment in prevention. And even though that we know it's a cost-effective intervention, as you said, it's much easier, even though it's not easy, but easier to get money for treatment than for prevention. And I don't know when that is going to shift, but I think that that is definitely one of the big commitments that we need to make. I raised it at the Sun Global Gathering. I think that the Sun networks also have a role to play in supporting this gap and moving it forward, because as we said, all forms of malnutrition and the prevention all need to sit together. So I hope that we can do some resource mobilization for prevention and begin to bring down our costs in general.
Okay.
Yeah. Just
Marie, I think I know we're way over.
I think I would like to add, Jeremy.
Oh, okay. Yes, go on.
Jeremy, if I may just, just a point I want to do that for us, again, the gap has been important of investments in FAO are going into emergency and social protection. And we know how social protection is expanding in response to the COVID. So the attention ability is something that we can do to leverage on existing resources. So before we have been talking about this context specificity, and it's important to really use a livelihood approach to define the context where the child find himself or herself.
Okay, thank you, Patrizia. Marie, we're way over deadline.
We are.
I'll let you wrap up.
Yes, we were on Irish time, but I think we've done well. I think we've covered a huge amount here, and I hope this is just the start of a very a big ongoing conversation. A few points. There have been questions pinging in on the chat box, and unfortunately we haven't been able to address them directly. But what we will do is we will collate them and we'll share them with the UN team and just unpick and get some answers. And what, if they are willing, what we can do is post the questions and answers on NNet, on our online forum, so we can share a link. So we've sprung this on you, UN panelists, but if you'd be happy to just maybe address some of the questions offline later on, we can then just post them on NNet. That would be fantastic. Because there's some really interesting ones, and they're covering full spectrum of issues, some very practical and some more policy related. So that would be great. There was also a question just about what are the front runner countries for the roadmap. So we can liaise with you, UNICEF, and we can easily share those with everyone. I want to say a big thank you to you all for checking in and participating, and a big thanks to the UN panel for making the time, considerable time and commitment, and such openness and transparency in having this conversation with us. So that is very much appreciated. Thanks to the Eleanor Crook Foundation and the team there who actually supported ENN in developing and delivering on this webinar. So that support is very much appreciated. And indeed to all of our long-standing supporters, to Field Exchange, which started all of this scrutiny off at ENN's side, and without this long-term support, this wouldn't have happened. And we will follow up with a very short evaluation just for you to complete to all participants, and we'll have a short technical brief that just summarizes what we shared with you today as a follow-up, and we'll send that to all you participants. So I think that's it. Again, a big thank you, and let's hope this is a number of several conversations, and have a good rest of the morning or evening wherever you are. Thank you.
Thank you, Jeremy, and thank you, Marie, and thank you, everyone.
Goodbye to all.
Thanks, Jeremy.
Bye-bye.
Thanks, Marie.
Bye-bye.
Bye-bye.
Take care. Bye-bye.
Oh.